Hi everyone, this is my second video for the class Human Lifespan, and we're covering children's mental health this week. And we had one article and two audio recordings that we were supposed to listen to, and then 3 questions to answer. And I typed them up because I really didn't want to forget something, so you'll have to forgive me for kind of reading off of my paper. And in order to do so, I have to put these lovelies on. So I know, and they create awful glare that I cannot stand. But so the first question was, what information in the article or the audio story surprised you and why? And for me, I would have to say the only thing that was surprising was the number of nurses, or lack thereof. I wasn't aware that there's maybe only one nurse for a whole school district, and that's horrible, especially if she's the one, like the video said, that is responsible for assessing mental health and for identifying children who might be in trouble. Because here's the thing that's, to me, the scariest thing. Okay, so even if all those nurses, in each school district, the one nurse that gets trained, that means that even then there's a huge lack. And in a battle type situation, and that's what we're facing here. We're battling mental health for these kids. In a battle type situation, the less doctors you have, the more casualties you have. And that's what I see happening with these kids. We're having a ton of casualties, and something needs to be done to rectify the situation so that we don't have our kids growing up to have the issues that they have nowadays. It's just horrible. The second question was, do you feel that schools have a responsibility to assess mental health of the students? Why and why not? And for this, I like to point out that public schools take our tax dollars and use them to educate these kids. Therefore, and what does it take to educate these kids? Well, as we've already learned, these kids need not only to have them taught the ABCs, the 1, 2, 3s, they need to have where they are taught how to self-regulate, how to deal with their emotions, to develop a great self-concept of themselves. And they can't do that without having a system in place by where they're educated not just on the academics. So mental health is a huge part of the growing brain, as we've learned, and we need to make sure that these children have just as much going for them in that field and are just as educated in that field. And therefore, the professionals that we use, the teachers we use, the administrators that we use need to be trained in mental health, because it needs to be a whole community that helps these kids. So with that said, what else can be done to help address mental health issues in the school-aged kids? For me, one thing that I think would really take care of the whole issue is that if people like you and I, who have taken classes in child development or psychology, if we were to take our knowledge base and to go and just volunteer anywhere we could, and even maybe take a less paying job like I'm doing for Teach for America, so that we can help give these kids a fighting chance, especially the poor neighborhoods. Like, if we just do that the first, like, preschool, kindergarten, first grade, second grade, third grade, these, like, years that we've just recently studied, we give them such a huge leg up on being able to overcome any other obstacle they have. And without having those tools, and without the mental health being addressed and, like, focused on, they're not going to learn anything in those classrooms, because the brain can't learn if it's under a great amount of stress, if it doesn't have the ability to know how to learn, and if it hasn't been nurtured to learn. And that's all part of mental health. So I hope we can really fix this, and that, like, you, like, do like what I'm doing, and find a way just to be the change that you want to see happen. Because without those type of people in the world, then nothing's going to change. It's going to be the way it is. So go us. Let's do this. Let's take care of mental health for the kids. And can't wait to see your posts. Bye.